Hello. Hello. I have a question for you. Do you feel like your body has a mind of its own, or that suddenly it's acting in ways that you're not used to, or the things that you used to do to get your body back to where you wanted it to be suddenly stopped working? If that's the case, you may have a metabolic disorder or a metabolic condition, or your body's just acting in a way that is metabolically dysregulated. I'm Dr. Catherine Toomer. I'm a family medicine and community health physician, and I'm going to tell you the 5 things that are most common. And at the end, I'm going to tell you how to correct them, how to find it, and how to correct it. I am a metabolic specialist. I have been working to helping people correct metabolic disease since I started my career 20 years ago. But I've been using GLP-1 specifically for the last 15 years to help people manage their weight and manage their metabolic status. Now, I am going to talk about ways that you can do this without medication, but we're going to get to that at the end. If you're listening, say hello. Let me know where you're listening from. And if you're listening later, put in hashtag replay and let me know where you're listening from there. Hello, Cindy. Thank you for tuning in from New Mexico. And Mindy from Charlotte, North Carolina. Hello, my neighbor. So there are 5 signs. Now, I don't know how to count, so I might end up talking about more than 5 signs, but we'll just see what happens when we get there. But I'm going to count backwards from 5 to 1 so that the number one reason is last, but I'll just let you know. So 5 signs that you may have a metabolic disorder. It's like what I just mentioned. Your body acts like it has a mind of its own. It's suddenly not reacting in the ways that it used to based on the activities that you used to do. And you're starting to notice that you're having weight gain. Or even if your weight's not going up, you notice that the shape of your body's starting to change. You're starting to get a middle heaviness. Your waist is growing, even if your weight's not going up. That usually is a sign that your body's putting down fat, visceral fat. And when your body puts down visceral fat, it's usually a sign that you have some type of metabolic disorder. And I'll go into, and so that is number 1, or number 5, I should say. I'm doing this backwards. The 4th sign that you may have a metabolic disorder is that you start to notice you have a dark ring around the base of your neck. Now, I've shown this to you before. I have diabetes. Diabetes is probably the number 1 metabolic condition. And so it's very obvious. Anyone who knows anything about diabetes can look at me and tell I'm diabetic. But if you haven't been diagnosed with diabetes, which, then, sometimes you just get this darkness around the base of your neck. The other is that you may get a darkness around this part of your face. And along with that darkness, you might get the 3rd sign of if you have metabolic condition, and that's hair in women. You get a beard and a mustache. You grow hair in this area, especially along the bottom of our chin. What that suggests is that, especially in women, is that our testosterone is high. Your testosterone goes up with metabolic conditions. And so having hair in this area can mean that you have a metabolic condition. And if that metabolic condition is corrected, that hair growth stops. It's one of the reasons that women who are going through menopause have hair growth in this area and darkening in this area. And that actually brings me to number 2. The reasons when women can't get pregnant. So number 1, they're already pregnant. So pregnancy in and of itself is a metabolic condition. If you've ever been pregnant and you are genetically predisposed to metabolic disease, either you have diabetes in your family, you have a lot of obesity in your family, you have a lot of infertility in your family, then that gene in your body could have very been turned on during pregnancy and it never turns back off. And that's often the reason why you often talk to women who've been pregnant who say, I have a hard time losing my baby weight. It's not because they're lazy. It's not because they're not disciplined. It's not because they're doing anything wrong. What happened is their metabolic condition got switched on. And so what happens is that everything they eat gets turned into fat very easily. So, like I mentioned, the number two reason is any reason that you can't get pregnant. So, number one, you're already pregnant. Number two, because of menopause, when we've lost the hormones in order to get pregnant. And then number three is infertility. And what it is that the hormones and the that are caused by the metabolic condition or add to a metabolic condition also cause infertility. And so, if you have difficulty getting pregnant and you're trying to get pregnant and you have any of the other symptoms, hair growth on your face, darkening around your neck, around your face, weight that you just can't seem to get off, um, any form of obesity, you could very well have a metabolic condition. Obesity, in and of itself, technically, is scientifically, not even technically, is a metabolic condition as well. And so, um, that brings me actually to number one. Before I continue, we say hello, Denise. Thank you for coming from Pennsylvania, joining us. So the number one reason, and before I get to the number one reason, I just do want to explain exactly what metabolic conditions are. It sounds a lot scarier than what it really is. And what metabolic condition really is just our body's inability to metabolize carbohydrates in the way that they should be, so that when we eat starches, we eat sugar, we eat carbohydrates. When we eat those things and our body cannot metabolize them properly, they go to making fat rather than going to make fuel for our muscles. And so we get really efficient. So it doesn't take a whole lot of food. It does, and it takes a whole lot of exercise, and it's just harder to lose that body's ability to make fat from food. So that is a metabolic condition. And so the number one reason that you may have a metabolic condition that you don't know about is because you've never been tested for it. And I'm going to talk to you right now about the tests that you can get done in order to find out if you have a metabolic condition or not. So before I go on, I'm just going to say hello to Elizabeth from North Carolina. Thank you for joining. So the way you test for a metabolic condition is first you get what's called a hemoglobin A1C. What a hemoglobin A1C is a blood test that tells us how high your blood sugars have been going over the past 3 months. The reason is the most common causes or the most common symptom of a metabolic condition is high blood sugar. And so when your blood sugar goes high, it attaches to red blood cells. Those red blood cells stay in your system for 3 months, and we test for it so we can see exactly how many has sugar on them, and that tells us what your A1C is. And it's called glycosylated hemoglobin. And so that means sugared red blood cells, basically, or what's in red blood cells. So we look for that, and anything from 5.6 to 6.4 is prediabetes. Anything from 6.5 and above is diabetes, and anything even below 6.4 could be insulin resistance, which is the other end of a metabolic condition. So all of these symptoms can happen even in a normal A1C. Because it's just an average. It doesn't say what happens when your blood sugars go up. It just means on average what they are. So the other thing that we test for is called a glucose tolerance test, preferably a 1 or 2 hour glucose tolerance test. Now, the way that I test them, people, I do not have them fast first, mainly because when we're walking around in life, we're not fasting before we eat. We eat and then we eat again. And so wherever your blood sugar was before you ate the second time is where is going to be affected. And so what I often do is to mimic what is considered normal life. You eat and then you eat again and then you eat again. So what I do is I test someone's blood sugar, then give them a glucose challenge, a blood sugar challenge, and then let them sit for an hour and check to see what their blood sugar is at the hour mark, and also check their free insulin level, both at the beginning and both at the 1 hour mark. Often, what you'll see, even with a normal hemoglobin A1C, you may see really high insulin levels because of insulin resistance, and or you may see high blood sugars, which tells me that your body's not metabolizing sugar like it's supposed to as quickly as it's supposed to, which means that your brain is probably telling your body make fat every time you eat something that drives your blood sugars up, which basically is anything that's a carbohydrate. Whether it's a little bit or a lot, your body's going to try and make fat out of it. And so if you've never been tested, those are the tests: A1C, blood sugar levels, but a glucose tolerance test that says what your blood sugar was when you started, an hour later after having been challenged. I can tell you tests that do not work. Hormonal testing is a waste of time. And the reason is we test people, unless you're young and you kind of look like you're going through menopause, we may test then. Otherwise, menopause is a diagnosis of history and just common sense. If you are having symptoms and you're in your 50s, you are going through menopause. We don't have to test your hormones to know that, especially since most women start going through menopause 15 years before their hormones start to change. At least their hormones start to change in a way that we can actually actually detect it in a test. So testing for hormones is a waste because it's based on history anyway. So if you're having symptoms, you're going through menopause. It's just a matter of why. And usually the most common reason why is age and family history. The other waste is testing for cortisol. Cortisol will put the body into a metabolic dysregulation. That means a stress hormone. Now, testing for it isn't going to change the fact that it's there or not. The fact that you're under stress, if you're under stress. If your body's, quacking like a duck, it's a duck. Well, I guess that's not really the metaphor, but anyway, you know what I mean. If it's doing all the things that cortisol does in the body, like make your middle grow larger, makes you irritable before and after meals, or at least has your mood changing with meals. Either you're irritable before and then you're calm after, or you're calm and then you eat, and then right after, like within an hour or so, you start getting very irritable. Then you probably have some metabolic issue going on, and cortisol could be the cause. But testing for it, we don't do that unless you have specific physical symptoms that go along with having a real adrenal problem, which is where cortisol is produced. So you can just presume it's there, presume it's high, and then just do all the things that are necessary to bring it down. And so when you have a metabolic condition, when you've tested for it and all your things show that you probably have something, no matter what your numbers show, because I'm a firm believer you treat the person, not their numbers, then you have hair, you have darkening, you have growth in the middle, you have irritability with meals, you have infertility, you have obesity, and you have a hard time losing weight. You've been pregnant and all of your symptoms started after pregnancy, or they all started right around the time of menopause. You have a metabolic condition, or at least metabolic dysregulation, even if it's not clinically diagnosable. And so the way to fix that is the 4 M's. Now, I should say, with men, this can happen also. All the symptoms are exactly the same for men, except the facial hair and the pregnancy, obviously. But everything else, the irritability or fatigue, I meant to mention, really sleepiness after eating, the growing through the middle, that can all be the weight gain, the kind of your body acting like it's got a mind of its own, having gaining weight very easily, but having a hard time losing it. Those are all also symptoms that men have as well. Um, so, how do you fix it? You fix it with the 4 M's. If you don't remember anything else, just remember the 4 M's. The 4 M's stand for muscle. Muscle is our metabolic powerhouse. It is the metabolic powerhouse of our body. It is the only metabolic powerhouse that we can control. We can control cortisol a little bit in our adrenal glands, yeah, but I mean like immediately control. So growing muscle, building muscle, doing resistance exercises helps with metabolic dysregulation. The more often, the more consistent, the more toned, the better your metabolic status is. The second M is meals. I'm not saying you've got to go on any type of special diet, but what you do is you make sure that your meals are protein forward. You want your meals to be centered around a protein, and then fiber. Then you can add carbohydrates, healthy fats, then carbohydrates. Carbohydrates should always be the least amount of your meals. And you should give up refined sugar. Anything with refined sugar is going to cause some dysregulation. I mean, that's just the truth of it. I'm not saying that you have to give it up for the rest of your life. Obviously, you have birthdays, you're going to want birthday cake. If you're at some, celebrations, you can have a little bit, but there's a way of managing it. I won't get into it right now. I do have videos on how to eat properly during the holidays. That's a good video for you to go watch if you want to know how to eat during celebrations or just really any day of the week. And so your meals. The third M is meditation or mindfulness. It really requires practice to bring your cortisol levels down using exercises in order to do that. Meditation is one, deep yoga breathing is another. I think last week, the video from last week, I did a deep breathing exercise, and that's going to be separated out from that. So that's going to be posted on my YouTube channel. So you can go there and actually use that to help bring your stress hormones down and therefore regulate your metabolic dysregulation. When your cortisol levels are high, your body it disrupts how your body treats food, all food. And when your cortisol levels are low, your body's less likely to make fat out of what you eat. And so it just always puts food into a better metabolic environment. So mindfulness, meditation is important. Now, there's one thing that can actually work on both muscle and meditation and mindfulness, and that's Pilates. I talk about Pilates a lot. So it just works. So that's an exercise that you can do. And then the fourth M is medication. Now, there's different medications depending on your diagnoses, depending on your comfort level, depending on where you are on the continuum. So with the medication, mood stabilization if it's required. Depression, anxiety are probably the two most common things that disrupt a person's metabolic status. Rich, I saw your question. I'll come back to you. Medication that helps stabilize your mood can help create an environment, a more favorable environment for food when you eat it. And so it also reduces your stress hormones because you're not stressing about stuff because you're not reacting in the way that you were before. And the second medication is GLP-1s. We've heard a lot about Zepbound, Mounjaro, Ozempic, Wegovy, Saxenda, Victoza, um, Trulicity. Those are all medications that act on metabolic regulation. It's the reason that diabetes medications, because diabetes, like I mentioned before, is the number one metabolic disruption condition or disease. So diabetic medications act on metabolic dysregulation, and that's why they work to that's why they result in weight loss, because it stops that mechanism that makes our body very efficient at taking food and turning it into fat. And that's why they work so well. You don't have to use them. It just makes regulation a whole lot easier and a whole lot quicker. But muscle, if you just want to go completely without any medication, muscle is the only way of doing it, and that's dedicated muscle growth and muscle. Um, so Rich says, is there food that reduce cortisol? There's not food that reduces cortisol, but there are foods that can have a positive effect on your moods. And there's way too many for me to mention all of them now. And many of them are not so much that it's the food themselves, it's what they're rich in. Like if they're rich in certain vitamins and minerals. Magnesium is one of those that helps. There's certain foods that are high in calcium. There's foods that help stimulate serotonin. So but I would just recommend Googling them. I know that's hearing a doctor say, go to Google, but really Google or even AI, checking, doing an AI questionnaire or question, just putting it in there will tell you. And it really just depends on your preferences, if you have any allergies, if you are on certain medications, if you take a multivitamin, which I recommend everybody should take a multivitamin. Our food just simply does not have the nutrients in it like they used to. And so, I mean, I know that doesn't fully answer your question, but it doesn't necessarily directly result in cortisol. It preferentially or peripherally acts on the things that then cause a reduction on cortisol. Okay. Are there any other questions? And if you have any questions later, you can write to me at help@drtumor.com, and I'll put that in the chat. And make sure you put in the subject that you can just say Dr. Tumor Talks question, or a topic question, or something that alerts me that this came from one of my talks. Is Pilates all sizes friendly? Absolutely, it is. It very much is. In fact, it's probably one of the most size friendly exercises, just like yoga, because there's different levels, and it's really it's like anything. You start off, it's a little clumsy, and then you just work your way into getting better and better at it. If you're feeling uncomfortable, because it's sometimes, and I've seen this often, it happened to me. For those of you who may not know, I've lost over 100 pounds. So I've seen how people act on both sides, and also as someone who's as a recipient, and then someone who is also a physician helping treat. And so when people have biases, people have prejudices, and if you're working with someone and you feel uncomfortable, they make you feel uncomfortable, they make it so that it's very clear they have a problem, go somewhere else. You do not need to have that kind of negativity. However, it's very important that you don't let yourself get discouraged and then stop altogether. But yeah, Pilates is probably one of the best size friendly. But then, but there's other exercises that can be done to help build muscle as well. And you can, there's lots of combinations that, do the same thing. Muscle toning plus meditation, or, and that does the same. Is high glucose the only criteria for diabetes? Not, it's unfortunately in medicine, yes. We're kind of limited in what we consider diabetes. One of them is A1C over 6.5 or above, or random fasting blood sugars that are 140 and above. And it has to happen on 3 different occasions. If you have blood sugars that are over 140, not just right after you've eaten, but I mean fasting blood sugars, meaning before you've eaten, and they're over 140, that will constitute diabetes. At least the type of diabetes that I'm talking about, type 2 diabetes. And however, there's a lot of time and conditions before you get to diabetes that do the exact same thing to your body and can be treated in the exact same way to prevent diabetes. And that's why GLP-1s work so well. And that's why they act on weight gain, they act on inflammation, they act on heart disease, kidney disease, dementia, they act on small vessels. By improve small vessels, they improve circulation, they lower blood pressure. It really does do a lot of other things besides the weight, which is the most popular reason people use the medication, but it's not the only benefit you get. Is insulin resistance still a threat after continuing weight training? Is this because of inherited factors and environment? So when it comes to insulin resistance, number one reason is genetics. There are a lot of things that, and then there are conditions that cause insulin resistance. Pregnancy is one. Stress is another. Menopause is another. And genetics, like I mentioned. So any of those things can make you insulin resistant. And so strength training is the best thing to counter it, but it's not the only, and it may not, and it has to be at a level that will counter it. It may or may not be enough. And so, yes, it is a combination. It's when when genetics meets the environment that triggers it. Yes, that's how you are. Insulin resistance or prediabetes. And usually insulin resistance left untreated or left unaddressed becomes prediabetes. Prediabetes left unaddressed becomes diabetes. My doc says I'm diabetic, but my A1C is not high, but my insulin is off the charts. Okay, so technically you'd be considered insulin resistant or prediabetes, unless there's some other numbers that your doctor has that suggests that you're diabetic. But high insulin just means that you're insulin resistant. It doesn't mean that you have diabetes unless your A1C is high. And if your A1C is not, in fact, during the early phases of insulin resistance going into prediabetes, your A1C may be low because when your insulin levels are high, it drops your blood sugar really, really low. So your average, your A1C may be low, but you're still not diabetic yet. So, if your insulin's off the charts, you're insulin resistant. And if your A1C is between 5.6 and 6.4, then you're pre-diabetic. But for medical diagnoses, there's a very narrow criteria to diagnose diabetes. However, how do I put this? Some people are getting very liberal with the diagnosis because it does help people then get certain medication, the best medication for their condition through their insurance. Because again, very antiquated, very narrow criteria for getting medications. And one of the reasons why I'm such an advocate for compounded medications, because there's a lot of metabolic conditions, a lot of metabolic diseases out there that don't fit the criteria for brand GLP-1s, unfortunately, but they're very beneficial. Okay. So yeah. So I mean, um, but again, I'm not, there's a lot of nuance in medicine. And, when somebody has access to all your information, they make a decision that's best for you based on all the information that they know. And so, um, all right. Any other questions? Well, if you have any questions, you can actually put them after the video. Please share and like the video, thumbs up. Share it with people who you feel may benefit from having this information. Share it on your Facebook, or um, subscribe if you haven't subscribed to my YouTube channel. And because really, I think that the more people, this is one of those silent killers that we don't talk enough about. And usually, if you combine this with hypertension, it can be very dangerous. It's a very dangerous combination. And so, if you know anyone who may have any of the signs, just let them know. Tell them to listen to this, and then they can ask me questions after the video if they have them, or email me with questions. Okay. All right. Well, thank you all for coming. I really do appreciate it. And I will see you next Tuesday yeah, I know, Cindy, like I have 1,000 subscribers. I know I finally got 1,000, but now I have to get 4,000. Was it 4,000 viewing hours so that I can create a studio within YouTube? So wouldn't that be fun? So all right, but I will see you every Tuesday right here on Dr. Tumor Talks on Tuesday. And thank you so much for coming. I did not pull up my intro before I started, but I won't make that mistake next week. So we can have our little drum beats at the end. All right. Good night, everybody.